Direct Anterior Hip Replacement, or DAHR. This video is specifically for the direct anterior total hip replacement and should not be followed if you had an anterior lateral or a posterior hip replacement. This video will be covering the dislocation precautions and tendonitis precautions for your new direct anterior total hip. Dislocation precautions for the direct anterior total hip replacement. Hip dislocation precaution is excessive hip flexion or bringing the knee all the way up to the chest. Or another example of that position in standing is to do a full squat, picking something up off the floor, knee to chest. To avoid the dislocation precaution when picking something up, get your leg out to the side and bend at the hip, keeping it at a moderate position. It can be easy to flex too far forward, getting up out of a recliner, or sitting down into a recliner if you're not careful, as in this example. Instead, kick the leg out in front of you a little bit and use your arms to help lower yourself gently, keeping the hip in a moderately flexed position. The other dislocation precaution is taking too large of a stride with your uninjured leg, leaving your surgical leg back behind you in an extended position, or stepping back with the surgical leg too far, again placing it in a very extended position behind the body. Simulate walking with a walker. A normal stride with the uninjured leg first is acceptable. However, an extended stride leaving the surgical leg behind you in extension is a dislocation precaution. Hip tendonitis precautions. Excessive hip flexion, such as laying on your back and raising your leg up in the air, isn't a dislocation precaution, but it is a tendonitis precaution and will cause a lot of pain and inflammation in the front of the hip. Standing and marching will have the same result. Try to avoid both of these activities during the first several weeks after your anterior direct hip replacement so as to avoid that pain on the front by the incision. Any activity recruiting the hip flexors repetitively should be avoided. Thank you for your time. Abiding by these precautions will help decrease any chance of dislocation and/or possible tendonitis or aggravation of the incision on your new total hip. We wish you well on your recovery.